I loved the MSW experience. And I know it's really tough right now because you're trying to get just through this research project. I had it marked off on my calendar, and the day that I turned it in at 5 o'clock, because it was due at 5, and so I raced to campus and managed to turn it in like at 4:59, I think. I know it's tough, and once you kind of get over that hump, you know, then you've got your internship and all this other stuff that's coming at you. But I found this summer after I graduated that I was sad. I missed it. I missed the whole experience of being here and, you know, being with a big group who was traveling the same road together to get out. But anyway, I want to tell you a little bit about how I came to maybe sit in your seat a few years back. I went to school to get my bachelor's degree in social work because I wanted to be a hospice social worker. That's what I wanted to be. I started out in business, and somebody in my family had an opportunity to use hospice, and I just felt it with every ounce of my being. That's what I was here to do. Is there anybody in the room that wants to go into hospice or has been there? Yeah? Anybody else? Or medical social work at all? Okay, there you go. All right. Because, you know, it's all kind of, it's similar. So anyway, that's why I got my bachelor's degree in social work, and I went to work as a social worker in hospice, but I found that with my bachelor's degree, I was floundering badly. And you know everything that I got on my yearly reviews said I was doing a good job. I felt like I wasn't giving enough to our patients. That, you know, being there and listening to them and doing all of those kinds of things and bringing resources to them, that was all good, but there was no way to measure, was it effective? Was it really helping anybody? So really that was why I went back and got my master's degree, because I wanted to be more effective. I wanted to feel like I had exhausted, you know, my ability to learn. And when I got to graduate school, I found out that that was never going to stop. Graduate school taught me how to find stuff out. You know, it taught me how to learn, I think. So anyway, that's why I came back to get my master's degree, because I wanted to be a hospice social worker. About a year out of my degree, and then I want to kind of go back, but a year out, I was working for a really little hospice company, and we decided that we were going to make a big movie. And that's where I met Drew, actually. After working with all these hospice patients for all these years, 15 years, and I had all these great stories that I was learning from them and their families. Because I always thought that being with somebody at the end of life was like being at a birth, which sounds kind of rude. It's an honor, right? And it has the same kind of feeling to it. You know, people are gathered, and there's stories being told, and you're there to usher something, you know, something in or something out. And I get chills just thinking about it even now. I'm so passionate about it, and it is an honor. So there were all these great stories, and I met a photographer, Randy Bacon, and we were chatting, and you know, I got this new video equipment. I wanna make a little documentary. Take 6 patients that want to come in and tell their story about how they feel about life at the end of it, and that grew to 13 participants. And so Randy created The Last Days of Extraordinary Lives, and I was gonna bring a copy in, and I went to find it, and I had like 6, and I've given them all away. So I'll make sure that Dr. Day gets one, and maybe you guys can. Well, it's worth it. Yeah. It's worth it. But Drew was the volunteer coordinator on that project, because it was a huge project. So he got a bunch of social work students. I don't know. There were probably several people here in the room who were there. And that's great. To make sure that that event went off. Who was there that night? Thank you guys very, very much. I was actually too sick to stay. I got the stomach bug, and so I actually wasn't at the premiere very long. But Anyway, so I tell you this to say that because of that movie, because I decided to do something that didn't pay me anything, but something that I felt really passionate about. I've been working as a hospice social worker and doing a little bit of marketing too, because they found out that I could do that too. So I was getting a little, I wanted to do something else. And so I got on all the job websites and would just type in hospice, trying to see what would come up. And a job at McKesson came up immediately on the first day that I decided I was going to see about looking into something different. I'd actually talked to Michelle about maybe going back and getting a PhD. Just something else was pulling at me, something bigger. I wanted to do something different. And so a job at McKesson software development company came up. Well, Michelle remembers this. I could barely turn a computer on when I went back to get my master's degree. That is a true story. If I didn't have my cohort to help me, I would have failed miserably. But I have a passion for hospice, and what they wanted was someone who had a master's degree and who had been a hospice clinician. So I went in and I interviewed, and surprisingly enough, and I don't know if Carolyn even knows this, my hiring manager, the thing she wanted to talk about was that movie. That's what she wanted to talk about. She wanted to talk about how the idea came up, how we managed to get all these people to say that they would fund it, and how we got these people to say that they would participate. She wanted to know about that. And so a couple weeks later, I got a new job. And so I work with McKesson, and I'm the clinical product manager for their hospice line. And so what I do is I work with the technicians that build the software that will eventually help clinicians all over the nation that work in hospice care. So it's kind of a big deal. I'm kind of excited about it. But I wanted to tell you guys that you find something that you're passionate about, and there really aren't any boundaries. There really aren't. And what you're learning in this classroom is a conduit for that, because you know how to evaluate data. Even though right now it feels overwhelming probably, you're absorbing a lot more than you think you are. You know how to read those journal articles that she's making you read and analyze. You know how to do all that. And because you know how to do all that, you know how to go find the information that's going to help you in your career. And ultimately, it's going to help all the people that you have chosen to help, chosen to work with. So you never know where your passion can take you. So now I have an opportunity to work with people like Carolyn Humphrey. Carolyn is a former editor of a journal of home healthcare nurse. And I work with Carolyn. Carolyn, she does research around the evidence-based practice for home health and for hospice. And she looks up all the data, and she checks all the newest research coming out, and she evaluates that, and she will inform this new product that we're creating around best practices for clinicians. So it's a really big honor for me to work with her, and she called last week and said she was going to be in town, and I said, hey, I got this gig, can you come over with me? So I want Carolyn to talk just a little bit. She said she wasn't going to, but I want her to. A little bit about her work around evidence-based practice, because that's what we all want to do. I mean, that's why you're here getting your master's degree in social work, because you want to be the best that you can be, and you want to apply the best, latest interventions that you can. So I want Carolyn to talk to you guys for a few minutes, and then I want to tell you a little bit about my personal journey while I was in school, and then we can talk about comps if you want to.
Yeah, this is really impromptu here, but I've never been one to avoid a conversation, especially a lecture kind of. I hope it's just a discussion and sharing a few brief things with you. I'm from Louisville, Kentucky, So I made the trip last night, yeah, on the plane. I'm going back tomorrow. I'm here for the 2 days to work at McKesson. I have worked with McKesson now for almost 3 years, working with them to build this new product. Long time to build a product, isn't it? It is, because nobody's ever done what we've done before in the sense of, and it's for home care and hospices, and as Angela says, we just we built it. I was in charge of the project when we built the Library of Evidence-Based Practice, and now it's in the technology, and so now we're updating the references, which is a big project all of its own. One thing my background is in nursing. I have a master's degree and a couple other degrees and stuff like that. I was an editor of a peer-reviewed journal, Home Healthcare Nurse, for 10 years, and had a great experience. I decided about I've been a nurse administrator. I was a CEO of an agency. Home care nurse, discharge planner. I taught in 3 different universities and School of Nursing, and I wrote a few books for home care nurses. My first one was Handbook of Home Care Nursing, so they could remember everything when we were out there, because I could never remember anything. So I had to write a book to help everybody else. And then I wrote an orientation to home care book and a couple other books. And I decided I really liked writing, and so because of all that, and writing, I firmly believe, helps make you a better speaker. You can't be one without the other. You really can't. You have to, because you also have to have your act together to know what you're talking about. And you have to write, for me, I have to write it down. So I think the one thing that Angie said, and Angie and I have known each other for exactly 4 weeks. And only because I flew out here 2 weeks ago. I was here for a couple of days when she was just starting. I just met her, and now we've made this email contact all the time, and found out they're pretty kindred spirits in many ways. So that's the fun thing of all of our lives, is when you connect with people, right? You just connect, and then you find out that you're all into this. And we just found driving over here, I said, oh, I should have talked to my yoga instructor. Yoga, you love yoga? And I'm like, yeah, here we go. So we just find more and more connections. But one thing Angie said right before, the end, she said, you need to know how to look for all these things. And I would say you need to know, you can look for everything, and you'll find now more than you ever wanted to in your whole entire human existence. And I believe that's one of our biggest problems now in the world, in the country, in all of our professions, is that there's so much out there. That what you're learning here, because I took a class like this too, was that you have to be able to cull through all that stuff you find and help the people you work with, that whatever role you're in, you have to help them cull through all that information, because there's just too much out there, and most of it's not very good. You have to know how to analyze and use all these things you're learning in this class, plus everything you're learning in another class, to dig down and find out what's relevant, what's been the research methodology's been, does it make sense, what did those statistics mean. And I probably would say, without being political, I know I'm in Missouri, which is a hot spot, but and tonight we're having the first presidential debate, but you'll find, because I found as I got older and I got smarter from this experience, that it'll drive you crazy as people talk about things and they only give you this much of the data. And they take it out of context, and I'm not just talking about politicians. I mean, you've probably learned on how to lie with statistics, but they take out something out of context, and everybody believes it, and I'm always usually talking to the television, going, that's not true, you didn't talk about this and that. And that's one thing you'll learn here, is how to talk to television, I hope. But just, I think that we are when I went to school 100 years ago, we didn't have, oh my God, you had to go to the library, work with paper. Oh, had to do index cards. Oh God, I'm showing my age. It was when I did my thesis, I had a whole stack. I collected data with the punch hole stuff, and you put them on a knitting needle, and you shook them, and the ones that fell out were response number 1, and the ones who shook out were response number 2 because you put the needle in where people punch. Have you ever done that? Oh my God. And it took me, weeks and weeks to gather my data and count cards. And so God bless the internet, and it really helps me do my job, but it's still a lot of work. The other thing that I would say why you really, really have to take this and use it, not just, I always taught senior level nursing students community health and home care, and they never did like that. By that time, they wanted to be in ICU and the emergency room. They wanted to work with IVs and stethoscopes and all this. And here we go into the house with stuff, and we do stuff in the home. So they never thought they needed what I was teaching them. So I was pretty defensive and walking in and saying, yeah, you really are going to learn this, believe me. You need to know this, and they need to know it, and you need to know it, because even if you work in an institution, you need to know what happens to those patients at home, in the community, and because you're in social work, you know more about that. But the idea of how many ways you can use it, I really encourage. Social work is such a great profession because you can use this with all your different clients and in different roles. But you need this, most of it now, to learn how to take care of yourselves and your families. And I will just quickly share, and then I'll be done. You need to know how to dig in and get the right data for everything you do for your patients, but everything you do for yourself. And my testimony here is that a nurse, as long as I've been a nurse, 4 years ago, in 2010, I was diagnosed with I had pain in the side of my face. I was diagnosed with a lesion there, and I had it removed. And it was benign. And I went on my happy way, but I still had pain. I had some paralysis, and I had a little more as time went on. But I went 3 years, and then the paralysis got a little bit more and everything. And I'm the kind of person that when my husband got diagnosed with prostate cancer about 18 years ago, I drug him to 3 opinions. I did all the research. I do that for patients, like you're going to do. Did it for everybody, but I'm here to tell you I never did that for myself. And in 2010, in the spring, I noticed I was having more paralysis and that. And by September, I learned that I did have cancer, that my doctor did not take out the tumor. He took out regular tissue. And that my cancer had eaten my jaw, my ear, and I then did a heck of a lot of research, folks. And you got to know, I was working on this project doing evidence-based while I was doing that. But I didn't do it for me. I don't know why, but I didn't do it for me. And I thought a lot about that. I ended up then doing the research, getting a couple second opinions, and ended up having major surgery at the Mayo Clinic in Rochester, Minnesota. Very big research institution. Those people there saved my lives, people, because they did what was supposed to be a 6-hour operation. It took 16 hours, and redid my jaw, and that's why I look like this, that's why I talk like this, and I just had plastic surgery to make myself a little better a few weeks ago. So I really dug in and found out what was wrong with me. And now there's enough literature out there that you have to think about how, or I hope you think, you don't have to do anything, but I hope that you see how not only you can use it for everyone else, you can use it for you, your family, your children, whatever. Because I just finished a white paper for McKesson on evidence-based practice, which made me go to the literature a little bit more to see why this is a big issue. And it is a big issue in the Affordable Care Act. There are plans in the Affordable Care Act, which people like to call Obamacare, whatever you want to call it, that do make requirements now for all providers to use evidence to base their care. That you're no longer going to be paid for how many home visits we had, how many days you're in the hospital, how many doctor's visits you have. You're going to be paid on if a patient got better. And the time is not relevant. You're not going to get paid for every visit. You're going to get paid in a quantum way. There are many instances in the Affordable Care Act that have evidence-based as a requirement for participating in the Medicare program, and it is way overdue. The statistics say that almost 50% of the care given to people in the United States is not based on evidence. 50, it's like 49-something%. The other startling statistic was that about 35 to 40% of the care we get, and that is in diagnostic as well as care, all those x-rays, all those CAT scans, all those things, they're not necessary. They're not necessary. And the best practice for finding my mass was an MRI. My doctor for 3 years did CAT scans, MRI. So that's an example of treatments and that. The problem we face, and I'm going to give you this last little tidbit because you're going to find this, and I think this is also a lot that's happening with all this discussion about whatever care you want to call it, is that as we move into using evidence, and I don't know if you talked about comparative effectiveness, but comparative effectiveness is when you look at the kind of care given and what's the most effective. So there are research studies that look at, if we treat the patient with this, we treat the patient with this, which is the most like. A CAT scan will show up XYZ and an MRI will show ABC. The movement for that is based on the fact that a lot of doctors, a lot of x-ray places, a lot of labs, you've heard about all the fraud and abuse. They're ordering these tests to make money, not necessarily for your patient's best interest. So as we take away those tests because of comparative effectiveness and evidence-based practice, what we hear is Obamacare. I'm making this too political, because we hear it all the time. Obamacare is not letting me have this test anymore. Okay? And every time I hear that, and I heard that a few weeks ago from the source of all knowledge, my brother-in-law, who lives in Eastern Kentucky. And he said, you know what? You can't have a colostomy anymore after you're 65 or something. I said, really? Where did you get that information? He goes, oh, do we fight? Well, so-and-so who works at the hospital's wife went to this doctor, and she had her colonoscopy, and the doctor said, oh, well, and she says, well, I'll see you in about 6 years. And he said, no, you won't. Because of Obamacare, you can't have any more colostomies. So what did I do? I went right to the computer, and I went to the right sources to see what the coverage was for colostomies, colonoscopies. And did I say colonoscopies?
Yes, no.
Anyhow, I have a little radiation to my brain too, so I use that as like an excuse. I have radiation after my surgery. But it's been a very long day in front of a computer too. Colonoscopies. She had a normal colonoscopy. She had no predisposing conditions that the research shows is linked to colon cancer. She also, in 3 years, would be 70, which the research has shown that after 70, the incidence of getting colon cancer goes significantly down. It's like 5% or something. So what you've got are these patients who don't have any risk factors. They don't have anything. It's not because of the reimbursement. She didn't fit into the category to have, in comparative effectiveness and evidence, that it's any worthwhile to have that procedure. The other piece of Obamacare is that if you have any predisposing factors, if you've ever had a polyp removed, if there's anything suspicious on your last colonoscopy, you can have one in the time period that the best practices show, which, depending on those variables, might be 3 years, might be 4 years, maybe 5 years. So there you go. Now, I didn't even share that with my brother-in-law yet, because first I was visiting him, I'd get out of town, I'd send him an email, because I can't stand to argue with him. But that's an example, I think, of what, and I'll end on one more example because this is so true, and I wish people who like Obamacare needs fixing, but it doesn't need to be trashed, that patient moves up from Florida, 75-year-old man moves up from Florida. You know, he's down there in the winter, he comes up, let's say he comes to Missouri to go home for the summer. He goes to his doctor and says, it's time for me to have my cardiac stress test. Now, if you know anything about cardiac stress tests, you do like this, you about die on the treadmill, and then they do this to you. And he had a heart condition, but it didn't have anything to do with being measured. The measure of a cardiac stress test didn't have anything to do with the chronic cardiac disease he had. And his doctor says, well, you really don't need, you really don't need one. He said, oh, yes, I do, because my doctor in Florida does one every 3 months. Okay, so what's going to happen is you're going to see that guy on TV who says, Obamacare or whatever, or my doctor in Missouri really is horrible because he won't do the test I need every 3 months. Now, I hope that not just from all of this, and I know from this class what will happen to you is you ain't going to believe nothing anymore about anything. Because you're going to go look it up, find it, you're going to be able to analyze it, and you're getting started. You'll get better as you do it, but you're going to do that because that's the only way. You're going to be so smart about this, it's the only way you can do it. Because you're not going to take anybody's word for it, you're going to find out yourself, and thank goodness you can use it that way. So I'm just sharing those examples because when you hear these comments from people, I think that's what we're going to have, I think we're already having the biggest backlash is with, especially these patients who come from Florida. Dear God, fraud and abuse in Florida is worse than Medicare fraud and abuse, worse than any other state. So you hear this, they think their doctor's all screwed up, but really, was their other doctor corrupt? Really, I'm just talking turkey here. But anyhow, I wasn't supposed to say anything, but here I
And now I get to work with great people like Carol.
We're the only two smart ones here. You already know that.
Okay, let's talk comps.
Can we just pretend we did and not?
No, let's do it. Because I have something really important to tell you guys. I did not pass the first time.
It's okay.
I did not do it. And I bawled. I kind of want to cry a little bit right now. I bawled and bawled and bawled and bawled and bawled. It was awful. It was an awful afternoon when I opened up that email. And I bawled. And then I got up the next day and I was like, all right, my sister's coming in from Dallas to see me walk across the stage in a few weeks, and so I got to get this under control. So anyway, the good news is I did pass. Do you guys have any questions just from a former student about it? Not me, probably, yeah. Well, this is what I learned because I took it twice. Not everybody can say that, right? So,
You have more insight.
I have more insight because I took it twice. That's a strengths perspective, right? It's very true. I learned something. Okay, so here's the deal. This is what I learned. Really rely on each other. Seriously, I probably am going to cry here. Honestly, Michelle asked me, or Dr. Day asked me, she said, what are some of the things that you would want to say? And really, it is relying on each other. We got together in groups, and quite honestly, I just kind of sloughed it off. I had, a study group. We'd study for tests and stuff together, and they were serious about it. They timed, they wrote out their references. They had those already written out. They timed themselves so that when we went and did the mock ones, they had, 10 minutes on this section, 15 on this, blah, 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 blah. And I was like, they are such nerds. I'm totally not going to pay attention to that. And it got me in some trouble because I'm kind of wordy and I love to write. And so I spent a lot of time writing. And this is not the time for that. So, if I've got any sage advice, that's probably the best. Rely on each other because you can bounce stuff off each other and you'll find references, you know, that the other ones won't get or have. Keep all of your textbooks. You won't want to, you can. You don't want to drag them in there with you, but keep them all because you'll use them for your references at the end when you have to reference everything. But you can get through it. Here's the other great thing, is all the professors are totally behind you. I didn't feel that, I wish I'd felt that a little earlier, wish I'd known that a little earlier, because when I didn't pass, I was embarrassed. I mean, I didn't want to see any of them. But they were like, okay, we're going to do this, we're going to, you know, have these sessions. And so I think there were, what, 6 of us here? Yeah, there were like 6 of us. And so a lot of it was a lot of the stuff I didn't listen to the first time.
Like the timing.
Like the timing. Yeah, the timing especially.
You said something about mock tests. Did they do a mock test?
We did them. We
Oh, you
just,
did?
yeah, I think that they give you, I can't remember, you guys do like sessions where you have,
This minimal, what you guys did with the timing, I think is really important.
oh my gosh, it was huge. It was huge. And we were all talking amongst each other about, you know, what's the best way to get through this thing. So we had kind of trial runs at it, right? And I don't know if Renee gave those out.
She did.
I think Renee gave,
Renee White.
yeah, Renee White.
She's not here.
If you, and I didn't make it to any of those study sessions, and that's okay. You know, it's busy. It's a busy semester. A lot of you work, have families. You're doing your practicum.
It seems like you were a little involved with some things too.
I was going through chemotherapy at the same time, but I didn't want to tell you that at the beginning because that is totally not why I didn't pass the first time. And I think that people probably thought that, but I swear it had absolutely nothing to do with it. I just really ignored some things that were pretty critical, and the timing was definitely one of them. But yeah, during my break in January, I had been, you know, ignoring symptoms and stuff. I'd lost a lot of weight, and what 40-year-old woman goes to the doctor and says, I just can't gain weight? But I was seeing a physician here at Taylor Health Clinic, and I said, it's just stress, you know, that, like you guys are all experiencing. And she said, I just don't think so. I just don't think that's it. You know? So right here on campus, she diagnosed me. She just I went like every 3 weeks, and after I turned in my research paper, actually, she goes, I promise I won't prod you anymore. We need to do a pap smear. And I said, I just had one 9 months ago. And she said, you know, that's all I have left to do to you. So turn your research paper in, come see me. So it was on the day. I turned my research paper in, I went to Taylor Health Clinic, and they couldn't get the speculum in. The tumor was the size of a grapefruit. Yeah. So I also say rely on each other because I'm here to tell you I couldn't have made it through without my cohort. They came and got me. I lived in the country. They came and got me and brought me to class. Yeah. And this I will cry now. But we're still close. You know, you interact with each other. You guys will graduate, and some of you will move. Even so, you know, Facebook, whatever. I reach out to my former classmates a lot. You know, I have a patient that needs something. What do you know about it? Or, you know, so you're in this together now, but you'll be in it together for a long time. It's kind of a showstopper.
I'm just thinking of them all sending me emails about how they're using your words of advice and research, and just looking forward to that.
It is great. And, you know, Carolyn's, I want to say one more thing. Carolyn said something about policy too, and Obama. That's another part of my job. I have to research policy, and what's very interesting about it is, as a clinician, I wish that I had known some of the things that I now, it's my job to know. But it's easy. These things aren't hard to find. You're right, Carolina, you need to be discerning. It's easy because it's, you know, there's so much propaganda out there. But, you know, all I do, I Google. I mean, I don't have anything magic at my station. I mean, I Google. I go to the CMS website. I go to these websites. It's out there. it's there for us to take. I think even some of the white papers.
Well,
are
I
on.
think also, and I'm sure you've covered that in class, you don't even have to open up all that stuff. Get familiar with the link.
Right.
And if you have to open it up, you first check, not what they said, but where did this come from?
Absolutely.
Is it public? And you know, there's Google Scholar. You all know that, rather than just Google too. And you just have to learn, and you'll learn more and more you do it. I must go on the web when I work 8 hours. I probably go on 50 to 70 times a day.
Well, and you guys are
I
at
just
advantage.
keep going because now I know the good sites, and I also use literature.
Well, you guys have an advantage. I asked Michelle last time I was in her office. I was like, "Can I pay to have access to the library,
know,
to the
it's
journals?
wonderful.
Because it's expensive. I mean, if you want to download an article, it's like $40 that you guys get. I mean, you guys can just get on the library website
You don't give it to
and
Alana?
yeah, apparently not.
Because I
Because
get
I
it
tried.
from our where we got our bachelor's degree. So
That's my next angle for our
We should
alumni.
advocate for that.
Absolutely.
Now, speaking, I have to say something. Speaking as a journal editor who for 10 years tried to get people to buy our journal.
Sorry.
Because and speaking as a book author who, and this was a long time ago, but I got a new position, and I didn't meet the person who was before me, but she left me files. And when I opened up her file, she copied 4 chapters of my book and was giving them out to students. Now, that was long before. Now you can't do that, thank God. And I mean, I open it up, and there I am. Because as an author, you don't get much. As an editor, you don't get paid much. But the used bookstores, the used books, they get all the money. Authors only get the royalties. But these companies, I mean, I don't want to sound too capitalistic, but we can't publish these things. It costs money. You know, whether it's a peer-reviewed journal or it's a newspaper, we can't do the work that needs to be done to produce the outcome unless we get some financial support. So I'm not against the alumni and that kind of thing, but for goodness sakes, when you graduate and have a job, and I've said this to nurses, I mean, I talk to nurses who make $75,000 a year and they can't spend $50 or $100 a year on professional journals. Come on. I mean, that's your obligation too. So I have to say something
No,
about
you're fine.
everything being free.
And I have paid.
Well, no, I mean, I don't understand why music can be downloaded free, because there are people who create it, and there are people who create books, and so you hit a nerve, and journals, and I think we have to be very careful, or we're going to lose.
I'm thinking it this way, as a paid member of an alumni association at a very reasonable fee,
Absolutely.
couldn't we somehow go through the university and provide appropriate access?
I couldn't agree more, but I really believe we can't continue looking at this as all free. And if it's not free, it's not good, because, well, we don't use it if it's
That's
not.
right.
And I think that there's a lot of things going on about free access and all that, but I do think we have to value some things and so buy a book.
But right
You can't
now,
buy mine, but buy some of it.
but right now you are paying through your fees
Yes,
to
you
get
are.
the
Yeah.
books you're getting.
Yeah.
But it's a big deal. Do you guys have anything else that? I hope this was valuable. It was fun for me. It's fun to see all your
Yeah, it's fun to
faces
see you.
and to know that you're in this and you're in this together. And I promise when you're a couple years out, you'll miss it. I promise you will, because I do. I miss it.
Then you can't get away from it. Someone
I
will say,
can't.
please come and speak to my
I
class.
can't get away from it because I love it so much. And in a way, I think it saved my life. I think being here and being with a cohort like you guys have is what saved my life. So, it's all the more reason for me to be grateful for it. Anyway, enjoy.
Yes.
Didn't mean to take up so much of
Thank
your
you.
time. If you guys have any questions, Michelle knows how to get in touch with me.
Job.
Absolutely. Here's a crazy thing. I'll just show you this. I'll be like Caroline. One last thing.
One more thing.
So I was leaving my job, right? And because I had gotten, I was like, oh gosh, I'm going to leave my job. And a former classmate swear to you, texted me on the day that I was worried about giving my resignation and said, do you know of anything? And she actually didn't work in hospice at all. She worked for Carol Jones, the recovery
For
center.
Sigma House.
Yeah,
She
yeah.
was my
There you
practice.
go, Sheila. Yeah, she
Oh,
texted
Sheila.
me
Yeah.
on that day. And I said, oh my gosh, this is an answer. And so she got my job, and so all was good. So yeah, I mean, you guys will continue. I mean, I hadn't seen Sheila in 2 years, and she knew I worked in hospice, thought I might know something, texted me, and so you'll use each other. You will. It's good. It's good. So anyway, thanks.
Thank you for your time.
Good to see you guys.
Probably the
I won't
best
miss
one
you.
over there. I did like 4 years, 6 years ago.
Thanks, guys, very much. Thank you.
Give me hope.
Okay, you can stop now.